Hey everyone, Jonathan Arkin here with Naprapat Landsläge. Super excited that you tuned into our video on fibromyalgia. Fibromyalgia is an extremely important disease that I want to take a moment to talk about because it can be very confusing for you as a patient and for us physicians. So what is fibromyalgia? Most of the time we call fibromyalgia an exclusatory diagnosis. So basically what happens is if you have chronic pains and your doctor can't figure out what's going on with you, we call you fibromyalgia. So in actuality, it's not really a disease, it's more a collection of symptoms, which can be why it's very confusing to many of you. So hopefully through the course of this video, we're gonna clarify some things that's gonna help you understand what's going on with you and why it's very difficult for your clinicians to help you out a bunch, all right? So normally when people are diagnosed with fibromyalgia, you've already been through the gambit. So your doctor has already excluded diagnoses such as rheumatoid arthritis or MS or MA or lots of other diseases that can also cause chronic pains. So when they get to a stopping point, when they can't figure out what is wrong with you, they call it fibromyalgia, they call it global pain, and they try to load you up with pain medication to help you deal with what's going on. Well, there's a few really important statistics about fibromyalgia that I'm going to share with you right here. Fibromyalgia patients are about 10 times more likely to commit suicide than the general population. This is due to the overwhelming amount of pain that they're constantly experiencing every single day. But there's a lot of other things that are going on with our fibromyalgia patients other than just pain. So for example, 90% of our fibromyalgia patients are also experiencing chronic fatigue. Chronic fatigue is just you're never energized. It doesn't matter how much you sleep. You can sleep 15 hours a night and you're still exhausted all day, every day. 30 to 50% of our fibromyalgia patients are generally experiencing IBS, otherwise known as irritable bowel syndrome. This is a condition that causes you to have cramps, nausea, it can cause you to have diarrhea, or sometimes it can even cause constipation. It's an enigma of a condition that messes up basically all of your gastric functions. 80% of our fibromyalgia patients experience a sleep issue. That can be they are sleeping too much, so they can sleep 12, 13, 14 hours a day and they're exhausted because of that, or they're having an insomnia where they can't fall asleep, or a problem where they can fall asleep but they can't stay asleep. Either way, these patients are very commonly experiencing interruptions of sleep, which can mess up basically everything in your entire life. And when we have sleep problems, that causes all of our pains to be worse. So it's a very vicious cycle. We've got 28% of physicians who don't actually even believe in fibromyalgia. And bear with me here for a moment, but I'm kind of one of them. So fibromyalgia is a terrible diagnosis that we generally just give to patients when we don't know what's wrong with you. Most of the time, in my experience, fibromyalgia is just misdiagnosed as a brain-based pain, which I'm going to speak to you about in just a moment, so make sure you stay tuned. 1/3 of all of our fibromyalgia patients also are experiencing migraines. And this will tie together really well with what I'm about to explain as far as our brain-based pain goes here in just a moment, okay? And then we have something about 2/3 of all of our fibromyalgia patients are experiencing some level of major depressive or anxiety symptoms. There's a bunch of psychological trauma that goes hand in hand with all of the physical agony these patients are in. Now, I am not saying that your pain and your disorder is not real. What I'm saying is that fibromyalgia is a terrible disorder that we need to get rid of the diagnosis for. In my experience, the vast majority of our fibromyalgia patients fall into one of, say, 3 categories. One, it's a misdiagnosis, and you're actually a patient who has a crippling disease like MS or rheumatoid arthritis. 2, it's going to be a nutritional deficiency, say, like a B vitamin deficiency or a magnesium deficiency. When we have these types of deficiencies, our muscles and our joints increase the amount of signals that they send to the brain, which makes them hurt more. And you can get global body pains that aren't real because there's nothing wrong with your joint or wrong with your muscle. It's actually a nutritional deficiency that's causing them to experience pain when they shouldn't. And this does happen to many patients. 3, what I believe in my experience has been almost every fibromyalgia patient I've ever seen, fibromyalgia is a brain-based pain. Now let me take a moment to explain to you what I mean by a brain-based pain. In our body, we don't actually feel pain the way most of us think we do. All right? In my skin, I have little receptors or little cells that tell me when someone is touching me. So say if somebody touches my hand, I can feel touch. Or if someone puts something hot or cold on me, I can feel hot, cold, sharp, dull, vibration. But I can't feel pain. It doesn't actually exist in the body. Instead, we have another sensation called nociception. And you do not have to remember that word. But what nociception is it's just these trillions of little cells all over our body that are constantly sending general information up to our brain. Now, our brain's job is to ignore all of that information coming from those nociceptors. And that might sound weird, but it's extremely important. This is why you don't feel the shirt on your back right now. Right? Now, if you pay attention, obviously you can feel the shirt on your back, but imagine if you couldn't ignore the feeling of the shirt on you, or the feeling of your underwear on you, or the air conditioning in the background. You would go crazy, insane. So it is actually a very protective mechanism for our brain to be able to ignore this nociception. Now, the way pain works is when we have too much of this nociception that we can no longer ignore it. So let's say that you punch me in my shoulder. Well, you punch me in my shoulder, there's too much of this nociception that activates my brain. My brain can't ignore it, so it will interpret that as a threat, and it will make me feel pain so I can get away. And that's the way pain actually works. Now, in migraines and all other sorts of brain-based pains, what's happening is the brain is, for whatever reason, is failing to ignore this nociception, and it is giving you the interpretation of pain when you shouldn't have pain. And this is a brain-based pain, which in my experience is the vast majority of the fibromyalgia patients that we've worked with. Now, when we treat fibromyalgia patients as brain-based pains, we typically get very good results in helping them. So what I recommend to you if you are suffering with this horrible disorder is that you look for a clinician who is experienced and capable of working with these brain-based pains. Because as you fix the brain-based pains, what happens is suddenly our brain can ignore these nociceptors and we don't make ourselves feel pain when we shouldn't be feeling pain. Fibromyalgia, while I think is a terrible name for the disease, and we should use something else like a brain-based pain, affects many, many, many people around the world. And unfortunately, it's not treated seriously because many times as clinicians, when we see patients and we don't know what's wrong with them, we kind of assume it's just not real, which is not the case at all. I know the suffering you're going through, but there is help out there for you. Look for clinicians who are familiar with the term of brain-based pain and see how they can help you. If you have any questions, you're more than welcome to always reach out to us at Naprapat Landsläge, and we will absolutely do our best to put you in touch with someone who can help you. Or if you're close to one of us, we'll talk to you about how we can help you out as well. All right, thank you so much for your attention. I hope everyone has a wonderful day.